Our featured speaker is Dr. Vivian Liao. She's a pharmacist who is the title is Clinical Associate Professor and Interim Chair for the Department of Pharmacy, practice at Mercer University College of Pharmacy here in Atlanta. Her area of expertise is pharmacokinetics. That's like what the medicines do and how they move through your body, seizures, and infectious diseases. She is going to talk to us today about how the pharmacist can be used to help us stay healthy and improve our overall health outcomes. So a lot of people know how to go to the doctor. We go to physical therapy, we go to occupational therapy, but we don't always make the best use of our pharmacist. So Dr. Liao is going to tell us what your pharmacy can do for you and how we can partner with our pharmacists to help us do better with our overall health. So Dr. Liao, the stage is yours. Thank you for joining us.
Great. Thank you so much for that welcome. And thank you so much for the invitation. I'm going to try to share my screen and talk at the same time. So give me 1 second. All right. There we go. All right. Okay. So thank you again for the introduction. I really appreciate the opportunity to be able to speak and share what I do every single day here at Mercer University College of Pharmacy. And I am located at the Atlanta campus, even though more people are familiar with our undergraduate program on the Macon campus. But I have been here for over 10 years, and I teach students every day about how to interact with patients and how to interact with the public. And just, I'm excited to share my role of pharmacy with you all. And given that, I'm a professor, I have to give some learning objectives, and you may not realize you need the resources and the things I'm going to talk about now. But my goal as an educator is always to give you something to take away. And so I'm going to first describe some challenges, and then of course can't talk about problems without talking about solutions. So I'm going to address some of the strategies that we can use to handle medication-related issues for the older adult. I'm also going to provide some resources that can improve medication access, and this is available to the public. And I made sure of that just because we have a lot of health information out there, and I wanted to provide some resources to the providers, but also for families and the patients, and just anyone who's interested in this topic. And then lastly, this very important topic, I want to show you all and let you know that a pharmacist can play a big role in your life as a healthcare provider. And I want to just say upfront that the resources and the information that I'm sharing with you today, I am not affiliated, or I don't have anything to disclose as far as personal relationships or financial. These are just resources that I found that could be helpful, but I don't have a personal stake. And I'm not recommending one versus another. It's just really more for your information and for you to investigate what works for you. So again, given that I'm a professor, I have to put up some fancy charts and some numbers. And just like with my students, every time they see some numbers, their eyes start to glaze over. So I always, when I put up a lot of words or numbers, I want to tell you all what to focus on. So this is a copy of the United States Census, which some of you may have participated in and completed, but just to set us up for our conversation today, I do want to share that there's a change from 2010 to 2020 that our population in the United States is growing. So compared to 2010, it grew by 7.4%. However, if you look at the selected groups of who is growing or which group is growing, it's really the older adults and the group older than 60. And you see from here, 65 years and older, you see a big change from 2010 to 2020. And really, while the population is growing, we are seeing a slowing down in terms of birth rates, and we are seeing older adults living longer, and that could be due to technology, just better improvement of health and better access to health. So there's a whole host of reasons in terms of why older adults are growing the way that we are in terms of the population. So when I see that the older adult population is growing, I always like to know, well, who is that? Who is this? Who are these? Who is in this group? And within the United States, 1 out of every 6 Americans are over the age of 65. And even though they're over the age of 65, we do know that this group is very diverse because there are, again, we're living longer and we have older adults in their 60s. We also have older adults in their 70s, 80s, and we also have adults living into to be 100. And so again, this is a very diverse group. It's a very fast moving group, a fast growing group. And we see that within this very heterogeneous, diverse group, we see that there are Americans, older adult Americans living below the poverty line, the poverty level. And interestingly enough, when I was preparing for this presentation, the statistics show that Asian American women who are older adults and who lived alone had the highest poverty rate. And again, another statistic that I found was that about 1/4 of older adults self-reported themselves in terms of their health as fair or poor. And that most adults, older adults, use at least 1 prescription medication. And the main top chronic conditions that are impacting older adults are hypertension or high blood pressure, arthritis, and cholesterol. So this is just a way to share. Now, this is just a fancy way to show that, with more chronic conditions and more medications are being used. And when you have more medications being used, there's the potential for more drug-related problems. So again, that's my take-home point. You don't have to memorize any of the numbers. I know the chart was hard to read and the numbers, but we know that the older adult and the population we are using, this group is using the healthcare system more, and that also means more out-of-pocket spending on medical services, in insurance and medications. Now, I do want to define some things before I continue with the presentation, and that is an average drug event. And so an average drug event is injury that results from just using medications. And sometimes the average drug event could be due to a medication error, or sometimes it's not preventable. But this is just an all-inclusive term. Sometimes you'll hear these terms used interchangeably. You'll hear people say an average drug event is the same as a medication error. But to be the most technical, technically, a medication error is an average drug event, but not every average drug event is a medication error. And so specifically, when we're talking about a medication error, that refers to any preventable event that can cause or lead to inappropriate medication use or cause harm. Now, when we continue with adverse drug events, we are, again, I put the diagram because I do put a lot of words on my slide, but I'm also cognizant of the visual learners. And so you can see that there's an intersection between where an adverse drug event and medication error meets, and that's usually the circle of prevention. So preventable adverse drug events are things like adverse drug reactions, or a failure of therapy, so it's not working, or you stop a medication and there are some withdrawal effects from the stopping the medication, and those are what we call preventable. There's also a term called ameliorable adverse drug events, and those are not preventable. However, the duration or the severity of the event can be reduced if there were different actions taken. So again, this is the intersection of what is considered an adverse drug event and a medication error. Now, again, older adults tend to use more medications. They're spending money and more out-of-pocket costs, and they are transitioning between healthcare systems. And so anytime they move from one setting to another, that's called a transition. And you can transition within different healthcare systems. So for example, if you're going from the hospital to a nursing home or long-term care, that is transitioning between systems. Now, we know that there's also transitions that occur within a system. So if you are moving from, let's say, the surgery floor to the medical floor, that's also transitioning within the system. And anytime you leave the system or are entering the system, there's the other on this part, and that could be, being sent to a nursing home or living in the community. But there's definitely a lot of touch points that an older adult has in terms of accessing a medication system. And on the left here are examples of all the different steps that are involved with the medication use process. So again, we have a lot of different steps, and you can see that there are a lot of areas where there potentially could be an adverse event or a medication error to occur. We have evidence to show that medication errors can occur during those care transition points, and this is where it's more likely to occur. Those main sources of errors occur during the prescribing portion, dispensing, and some documentation. Now, that's not to say that there are not sources of errors in the other sections, but this is where we tend to see a higher chance of where errors can occur. And what the types of errors that we're seeing are wrong doses, wrong medications, or even wrong administration. So this could be maybe giving a medication from a capsule versus a tablet, or this could be administering a medication to the wrong patient if you're within a health system. We do know that there are certain classes or certain medications that are more likely to occur in terms of error. And that's warfarin. So warfarin is an anticoagulant, also known as a blood thinner. And there's insulin can cause or has been involved in medication errors as well. And then we have lorazepam and hydrocodone. These are part of the sedative and hypnotics and the opioid family. So again, this is also there's evidence to show that these medications are more likely to be involved anytime an error happens. We also know that when an error occurs during these care transition phases, that the chances of these errors causing harm to a person is higher. There's also a higher chance that these errors could be repeated. So for example, if an error occurs at the prescribing step and then is carried on to the discharge phase, that error can be continued when the patient is discharged to the community, because that error continues. So it's a repeat error. And unfortunately, we do know that the risk is higher for patients who aren't able to direct or participate in their own care. So this leads me to my next point in terms of the older adult population. And according to the Center for Disease Control, a vulnerable population is any group of people that, well, can either have challenges with communicating their needs or has any difficulty accessing care. There could be some difficulties in maintaining independence, requiring supervision. And also this vulnerable population could need help with transportation. So I do want to know that this isn't an all-encompassing category. You don't have to meet all of this to be considered a vulnerable population. That and the definition of vulnerable population could be different depending on the situation. And so again, note that age isn't part of the definition. However, we do know that the age can be an example of a vulnerable population. And just like I mentioned at the beginning, we know that the older adults are a very diverse group, and so they also have different experiences in terms of social economic status, home security, in terms of geographic location. And so all of these contribute to the complexities of an older adult and also in the management of their care. So as I mentioned, the healthcare system is already very complex, and we know that older adults already face a lot of challenges. So you can see, hopefully, based on what I've discussed, that the setup so far is pretty much the perfect storm that could occur without an active participant or somebody actively involved in guiding and directing, managing the care. So you add this on top of, some significant social changes for people with dementia or cognitive impairment. And then you also add the complexities of, the interpersonal dynamics within the families and other things that contribute to the knowledge and communication. So hopefully this just shows that it adds another layer of stress for the patient and the care providers. For the sake of this presentation, of course, my focus is on medications, but I think I like this figure because it gives a great visual for the complexities of a person who is living with dementia and their caregivers and all the things that they have to navigate. So after I've showed you how that, I've shown that how this could be a perfect storm, I also then want to bring to your attention things that pharmacists can do to help you or your loved ones, or maybe you can tell somebody about this. So pharmacists are highly qualified to be the medication experts. So I train students in this role, and our program is 4 years long. And so we also have the students will spend an additional 2 years, they have prerequisites that they must meet before entering our classrooms. And so this is a total of 6 years of education that's all focused specifically on disease state management, medications, and patient education, just all on medications. And then we're also very accessible. So we are actually the most accessible healthcare professionals according to the Georgia Pharmacy Association. Out in Georgia, we have over 9,000 pharmacists, and we definitely are accessible if you think about, on a Friday evening when the clinic or provider's office is closed and you really don't want to go to an urgent care emergency department, and you don't know what's wrong. You can bet that for a pretty good chance that you can find a pharmacy that's open. And most Americans live within 5 miles of a community pharmacy. And so the pharmacy is embedded within the neighborhoods, even in communities that have a high poverty rate. And we do know that Americans will visit their pharmacies more often than their providers. Because you may need to go to get a loaf of bread or purchase some candy. So it's designed to be functioning within the neighborhoods and within communities. And then lastly, pharmacists are very trusted as a group of professionals. So again, according to the most recent poll, we scored in the top third. We were #1 at one point, and we dropped down to as low as 5. But in general, we are very trustworthy, and the public trusts us as medical professionals. So for those reasons, we are in a great position to help navigate a stressful situation for a vulnerable population. So I have this chart here to show all the different considerations that are needed for an older adult. My students learn about the fancy term pharmacodynamic and pharmacokinetic changes, but for the discussion today, I'm going to focus on adherence, medication efficacy and safety, and then also access to care. But all of these contribute to how a person responds to the medication, and it can be quite complex. Now, I want to talk about what a pharmacist can do. This isn't an all-inclusive list, but first and foremost, we are concerned about safety. Our first oath and our motto is do no harm. So we first focus on the safety of the medications, and we also play a big role in improving access to medications and just care overall. We also evaluate to make sure that the medication that has been prescribed is appropriate, and we play a decision-making role in deciding the type of therapy that a patient can receive. We can help with improving adherence to a regimen. We definitely are big players in terms of navigating those transition points between care systems. And we also can help with determining whether or not the condition that a person is experiencing is something that you can manage on your own. We know that many people do not want to go sit in a hospital or emergency department if this is something that they can go address themselves. So a pharmacist can play a big role in recommending self-care options. And all of these contribute to making sure that we optimize the medications that is provided or prescribed for you. One of the most common benefits that I want to first mention, of course, is that's open to all older adults enrolled in a Medicare Part D plan is something called a medication therapy management. So this is something that is offered once a year that is covered by the plan sponsor. And as part of the plan sponsor, you get to have a consultation with a pharmacist as part of a comprehensive medication review. Sometimes it's called a CMR. And through these appointments, through these consultations that can occur in person or telehealth appointment, this could be with the patient, or if a person is not able to be actively involved, then it could be an authorized agent. But during these appointments, a pharmacist or another healthcare provider will obtain information, and there will be a thorough review of all the prescription medications that a person is taking, and that includes non-prescription medications. So sometimes we call that over the counter because this is something you just buy off the shelves. It also includes dietary supplements and herbal products and vitamins. Now, there are some criteria points that you have to meet, and there are a couple of options. So again, this is part of the CMS contract that's offered, and it's updated every year. So I have the link for this for the 2025 year, but each plan sponsor has the first option is open for everyone. The beneficiary has to have at least 2 or 3 multiple chronic diseases and be on at least 2 to 8 medications, prescription medications, and there has to be an annual drug cost that exceeds about $1,600 for 2025. And again, this number can change every year, so CMS will decide this, but that's the criteria that they've set for the upcoming year. And if a person does not meet option 1, there's also option 2, which they define that as an at-risk beneficiary that's defined by the plan. So you might be wondering, well, what are these chronic conditions? CMS has 10 conditions that they call core chronic health conditions. And so if a person has any of these conditions that could, and multiple of these, so at least 2 or 3 of these conditions, that's part of the eligibility criteria. Now, I will say that each plan has their own specific criteria for option 2 in terms of what is considered at risk if it's not one of these core chronic health conditions. And so it is important for you all to contact your own plan provider and make sure to see what is covered, because again, each plan is specific to offer the appointments based on their own criteria, especially under that option 2 phase, because there could be more conditions covered under option 2, but that's mostly based on the specific plan. Now, the point of having a review is to make sure that we help the patient improve the medication use, and also we're making sure that the patient is tolerating the medications okay, to reduce that risk of those adverse drug events and the medication errors that I referred to on those previous slides. We also want to make sure that the patient stays on the therapy so that they meet certain goals. And so again, these are some touch points for a patient that we have from a pharmacist perspective to be able to assess a person's therapy. And then we can develop a plan to address any medication related problems. So if there's a problem that's been identified, Even though there is an annual review that's offered under the plan, if there's a problem that's been identified, then the beneficiary actually has quarterly targeted reviews by the pharmacist or healthcare provider just to make sure that we're on track with meeting those goals and addressing those problems. And another great set of information that's offered during the CMR is that the pharmacist can provide information about how to dispose of drugs in a safe way, especially if medications are being switched or if the medications no longer needed. There's important information about how to dispose of those in a safe way. I also want to provide some examples of what is called what we see as a pharmacist during these reviews. So these are called medication-related problems. Sometimes they're abbreviated as MRPs, but they generally fall under a couple of different categories. So one is medication overuse. We have patients who have polypharmacy, which is defined as a person using 4 or more medications. And that could be due to what we call a prescribing cascade. So a prescribing cascade occurs when a patient is prescribed one medication, and as we know that there is side effects for every medication you're on, no medication is benign, but a patient will experience a side effect that's caused by the prescribing cascade, or the patient will be experiencing a side effect from medication 1, and then they'll get a medication to treat the side effect, and they will be on medication 2. So it's called a prescribing cascade because you continue to prescribe and the patient continues to receive medications to treat another side effect. So it becomes a cascade. So that's an example of medication overuse. There could be medication underuse when a patient experiences some side effects, and typically unwanted side effects that causes the patients to stop taking the medication. And a lot of times those won't be reported to the prescriber, but the pharmacist will know because they can see from their refill history that they're not picking up medications as frequently as needed. Another example of a medication-related problem is non-adherence. And so there are intentional and non-intentional ways of non-adherence. But again, if you think about the older adult, they could be on a fixed income. And so an older adult commonly can try to make their monthly supply of medications stretch until their next, toward the end of the month, until their income comes in. And so that's an example of non-adherence, is just because of the income restriction. We also know that there are some medications that are used inappropriately in elderly patients. And so there are some clinical charts and lists about certain medications should generally be avoided in older adults just because there's a risk of falls or it can cause oversedation. And so we look for those as well. And then with all medications, we also want to make sure that they don't interact with each other. And this goes for prescription medications, supplements, or herbal products, and just to make sure that this doesn't cause an adverse drug event. So at this point, I want to switch gears and give some resources and suggestions of what I commonly see and what I suggest can help caregivers and families navigating a difficult and a complex health system. First and foremost, I definitely highly recommend that families and caregivers create a medication list, if not already, that includes the specific drug, a specific dose, so how much the patient or the person is taking, and then also when the medication was started. And also what's important is to create a contact list of the healthcare providers and also the contact for the pharmacy. And that way the information can be verified anytime the older adult goes to a different health system or healthcare setting. And if possible, I recommend utilizing technology. There are definitely some medication apps that are out there that you can create to remind the patient to take the medication. And there's also shared calendars available just to make sure that the information can be distributed with all the caregivers. I also included a link here to just a list of resources that's available. So here, based on the link, this is an example of a medication reminder form. Again, there are a lot of different templates out there. I'm not necessarily recommending this one. This is just an example of how a list can be created that includes the drug, the dose, and the start date. And so again, it can also include, why am I taking this medication? How much do I take? And how do I take this medication? And you can create one for morning, evening, weekends. You can be as creative and as specific as we need to be. And with this, I also want to further continue with the resources that I have found and that I can recommend. So again, older adults tend to be on a fixed income, and so accessing care can be a barrier. And so I have a list of references, and both nationally and also within Georgia, and you can put in your zip code and find areas that offer free or local clinics that can be accessible. The medication assistance tool is another great form of technology that includes a search engine to find ways to help with medication accessibility. So that includes having savings cards. There's also a search engine on how to access low-cost or free health clinics. That's in addition to some of the resources that I included in the previous slide. And then on this Medicare.gov, this is a database to search for medication assistance programs that are offered by pharmaceutical companies. And this is another great resource because it also includes the eligibility criteria, and it also includes the forms that you have to fill out, and also where and how to send the forms. And further, I'm going to keep talking about medication assistance. So this is not an all-inclusive list, but this information comes from the Agency for Healthcare Research and Quality, or often known as AHRQ. But there are ways to access and help with patient assistance programs just to help with medications. So again, this is for older adults who are on fixed income, but this isn't just open to older adults. This is open to anybody who wants to investigate and kind of seek out additional support to help with the cost of medications. I also want to transition into where to find information. As we know, technology has improved significantly, and we find ourselves just looking up health information online faster than we can pick up the phone. However, not all the references that you look up are reputable and also reliable. And so I wanted to provide 2 ways to look up references for natural products and supplements. So there's the perception that herbal products and natural products are safer, when in fact we just don't have as much information about those compared to prescription drugs. The website from Memorial Sloan Kettering Cancer Center, they have an integrative medicine team in a section, and so they put together a very comprehensive site about herbal products here, and they also have an app called About Herbs that you can download. And if you are on the website, you can have patient education. There's information for providers as well that you can print out and hand to a caregiver or other family members. So I think that's a great reference. I tell my students about this resource as well. And then if you want to get a little bit more technical, the NIH, National Institutes of Health, they have a database called the Dietary Supplements Ingredients Database. And this is a comprehensive list database that includes the amount of ingredients or the levels of ingredients that are in the dietary products that are sold. Again, keep in mind that dietary products are not considered medications. They are regulated. They're not regulated the same way that prescription medications are. And so oftentimes we don't know the exact amount of the herbal products that are in from brand to brand. So this website can help kind of estimate the amount that's out in the products that you see. They also have some research, and it includes some updated information about what studies are out there ongoing about the natural products. So I think this is also very helpful. Again, this website is more scientific, but if you're curious, I encourage you to look up the dietary supplements and ingredients database. For those who speak multiple languages, and if English is not your primary language, there's also a great technology, the health information reference, or the health information translations. There's technology available to translate medical language in different languages besides English. So again, I've put some of the websites on there. If you're a healthcare provider and you're struggling to communicate with your patient and making the medical jargon breaking it down, you're having trouble with a more simplified version, there is a website that's sponsored by the University of Michigan. They have a medical dictionary that can explain medical terms in a more simple way that everyday people or lay people can understand. So I also find that's helpful as well. So to conclude, I also want to again emphasize that pharmacists can play a big impact on how to identify patients who are at risk for non-adherence. So again, if patients are not taking the medications, a lot of time a prescriber will not know, but the pharmacist will, because we see them in the community very frequently, or we don't see them, and that's how we know. We are advocates for patients to access with healthcare within the healthcare setting, but also between the systems and the different touch points. And if we need to, we will refer patients to seek the appropriate follow-up care if it's not something that they can manage on their own with some of the self-care options. And we will address the patient's concerns so that we can address their adherence, and also we can know whether or not they understand the information that's presented to them based on their level of health literacy. So again, this is a very quick version of some of the things that we do as pharmacists, but we have pharmacists throughout the state of Georgia, all over in a community setting and a hospital setting. We also have pharmacists making decisions about formularies. So pharmacists are everywhere. We just help with all of these. And again, this is the very quick version. So with that, I thank you so much for listening, and I hope this was helpful. And I will turn it back to Dr. Parker.
Thank you so much, Dr. Liao. This was very helpful. I think that a lot of people looking at some of the questions I only see a couple that are in the chat. I think people are surprised, but a lot of people have asked me some strange questions like, can you take medicines with grapefruit juice? What's the effect of grapefruit juice? And I know that it affects certain medications differently. And then there's some things about how can you help people take the right medicines if all the medicines look the same? These sound like things that you should ask your pharmacist about. These are the very things that I think the pharmacist can help with. But let's talk about grapefruit juice, and should you take any kind of juice when you're taking your prescription medicines?
Great question. Thank you so much for that. So to answer your question, with your medications, you should take your medications with plain water. That is the safest and the most assured way that there will be no interactions when you are taking the medication. However, we do know that, people don't like the taste of water. It doesn't taste like anything. Some people don't like it. And so if there are no other options, I would say it's okay to take it with juice. However, you do need to let your pharmacist know, and also let your physician know because anything besides water can increase the likelihood that there could be interactions. So this isn't just related to juice. It could be milk. I know you didn't ask about milk, but milk can interact with the medication, and juice can too. And so grapefruit juice does get a bad reputation because it can interfere with the medications. And depending on what that medication is, grapefruit juice can either increase the concentration of the drug to push up the levels, or it can cause the medication not to work as well. So either way, the effects can be unpredictable just depending on what that specific medication is. So again, to be the safest, I would highly recommend with water.
Okay, and another question that's in the Q&A section is for the medication management. Is there a cost, out-of-pocket cost to the person for that kind of consultation? I feel like everybody needs to go see, based on what you're saying, I feel like anybody leaving the hospital should take their pharmacy, their discharge medication list directly to the pharmacist and go over it with them, because that's probably the best way to make sure that they're up to date. But can you talk a little bit more about what it costs to see the pharmacist, to have him or her review the medicines and the side effects?
Sure. So to answer your question, yes, so there's no out-of-pocket cost for the consultation. It is a coverage, as long as you have your Medicare Part D coverage, that is part of, you're enrolled in it unless you choose to opt out. And so as far as scheduling the appointment, this is where you would have to contact your plan provider to find out how to access that resource. A lot of people go to their pharmacy and ask about it, and some pharmacies have contracts with these plan sponsors to offer it, but some don't. So again, the pharmacy is a good place to start. And I think usually after the hospital discharge, where you have a long list of medications, I think that's usually a good starting point to ask for those. But I will say, as somebody who works in a hospital system, anytime a patient is admitted to the hospital or being discharged out of the hospital, there are pharmacists who review those medication lists. And so I think once the patient is discharged, it is important to take that list to the pharmacy. And this is also where, if you can get your medications from one pharmacy, that reduces the chances that you'll have medication records at multiple different sites. So if you go to one pharmacy, you can keep all of your records in one database, and that again helps streamline some of that process.
So on that note, when it comes to using one pharmacist, do pharmacists, like, let's just say I have most of my prescriptions at CVS, but I'm out of town and I went to see an urgent care doctor and I'm going to Walgreens. Is Walgreens going to be able to show up in some record database such that they know that I've been to Walgreens for my medications? How do you know what medicines people are on? I know that it works for narcotics, but what about other things?
So if it's not a controlled substance like a narcotics, depending on the healthcare system, some healthcare systems communicate with each other. So within Georgia, if you have Epic or some of the other hospital systems, you can pull medication and fill records when you're in the hospital. Now, if you're out of state or you go to another place, I can't speak to if that access will be there if you're, going between states. However, I think that's one reason that I recommend just sticking with one pharmacy, and then also my reasoning for creating your own list. And that way you have your own list of medications that's comprehensive, when you started it, and then the prescribers, because anytime you take that information, as long as your healthcare providers can find a way to verify your records, once you authorize that, they can send the records to the location that you are either admitted to or at the clinic.
Okay. I think there's One other question that I found here in the ad, the chat, excuse me. Something about, okay, magnesium. Oh, there was something about lists of medication interactions with herbals. You did provide a reference for that, I thought. Like there was a list of what medicines are herbals that may interact with other drugs. When I give talks, I talk about Beer's criteria, but this is specifically about herbal medicines. Would you mind re-listing whatever that was? It was
Yeah,
a
so the Memorial, the Kettering Memorial, the Cancer Center website, the integrative medicine, say from Memorial Kettering, Sloan Kettering. That website with the About Herbs app, they give information about the herbs and supplements, and there is a way that they describe if it interacts with other medication. Now, again, this is available to the general public, and if you have a specific question that you cannot find, you can also contact your local pharmacy, and they can have information based on the resources that they have as healthcare providers. They can look up that information up for you.
Okay, thank you so much. There are several different links that are in the chat. This particular tape or program will be available on our YouTube website within the week. So you'll be able to replay Dr. Liao's presentation. Grab any of the links that you see that are in the chat that can help with the different questions that you have. Thank you so much, Dr. Liao, for joining us today and for the very valuable resources you've provided. Okay, there's the Sloan Cancer Center database about herbal supplements and interactions. I think a lot of our patients take a lot of so-called herbal medicines thinking they're better than prescribed medicines. And a lot of times they're worse because they interact with the prescribed medicine. So there's the link for herbal medications and interactions. And again, this presentation will be available within the week. And you can listen again and share this particular webinar with your family and your friends. So join us next week at 2 p.m. where we will have another very informative and engaging program. And if